Okay, Chapter 5, Exposure Control, Barriers for Patient and Clinician. In this chapter, we're going to be talking about infection control, including immunizations for the healthcare provider, PPEs, which include the clinical attire or protective clothing, also hair and head coverings, the use of face mask and respiratory protection to protect us from aerosols. We're also going to talk about mask efficacy and the use of a mask. Use of protective eyewear. We're going to talk about the indications for use of protective eyewear. They do go on both the clinician and the patient. And then suggestions for clinical application. Okay. Hand care. We're going to talk about the bacteriology of the skin and hand care and hand hygiene principles, which would include the rationale, purpose, and facilities that we would be using. We're going to talk about methods of hand washing, the indications and description. I think those are actually on the next slide. There we go. Gloving, the criteria for selecting which gloves to wear and when, the type of gloves that are available, procedures for the use of gloves, factors affecting glove integrity. We're also going to be talking about the latex hypersensitivity, documentation, everyday ethics, and factors that you're going to teach your patient. All right, our learning objectives. After studying this chapter, you should be able to identify the key terms and concepts related to exposure control, clinical barriers, and latex sensitivity. 2, you're going to explain the rationale and techniques for exposure control. 3, you're going to identify the criteria for selecting effective barriers. 4, explain the rationale, mechanics, and guidelines for hand hygiene, and identify and describe clinical manifestations and management of latex sensitivity. All right, here are our key terms. Again, I suggest that you make little study cards, flashcards, with all of these words and their meanings on them. Okay, let's talk a little bit about our standard precautions here. Let's see here. Standard precautions are using the same barriers no matter the patient. So we're treating everybody as though they are infected, okay? Exposure control refers to all the procedures during clinical care that's necessary to provide top-level protection from exposure to the infectious agents for both the members of the dental team and their patients. The dental healthcare provider, our personnel, have an obligation to serve all patients with comprehensive oral care, including patients with unknown and known communicable diseases such as HIV, right? We still have to see them. Sorry about that. Standard precautions, again, the practice of standard precautions means that body fluids of all patients are treated as if they're infectious. It's an organized system for exposure control, and it's needed. A written exposure control plan is prepared to serve as a guide for the entire team. The written plan can be a basis for training of new personnel. So having this written control plan is super important. One example that I have is the cleaner for our suction lines. Okay, it comes in you mix it and it goes into a bottle that then the lines hook onto to clean it. And so everybody in the office needs to know, do we grab that with dirty hands or do we grab that with clean hands? Okay, because at one point we transition from clean to dirty, right? So when you're grabbing it, we say clean hands here, but in the office that you're in, maybe it's dirty hands. So you want to be able to know where, what each office is doing. You want to have a well-prepared plan, okay? Let's see here. This plan is then revised as it's constantly being revised in both our clinic and in the dental office, especially as new objects and devices are coming and going out of the dental office. So using protocol and transferring the objectives and overall aims to the clinical setting are the responsibility of each team member. Physical barriers, such as the plastic sticky barriers that go on the handles, plastic barriers that go on the mouse of the computer, those are all requirements and protocol to provide safe care for both the patient and a safe environment for the dental healthcare professional. Refer to Appendix 4 to review the specific recommendations from the U.S. Department of Health and Human Services. So do review that, okay? All right, immunizations. It is important for the dental healthcare worker to undergo immunizations because you are exposed to so many bacteria and viruses in the dental setting. Remember, the oral cavity is a port of exit also, a port of entry and a port of exit. So basic immunizations are recommended and established by the ACIP, and so we are recommended to have the hepatitis B, which I believe you have to have before you start in our clinic, influenza annually, the measles, mumps, and rubella, pertussis, the varicella zoster virus or immunization, the Manitou test annually, and any additional tests that would become available in the future. All right, so management program, records of personal immunization are regularly updated. So your office will have a person that is designated to keep track of everybody's files, and they're going to have a file on your immunizations, and it will be updated at least annually, because when you get your influenza vaccination, it should be updated, right? And then different climates and countries and locations are going to require different vaccines, so just be aware of that. And obtain the test promptly when you're exposed. Okay, so let's talk a little bit about PPE. Our protective clothing, such as gowns and jackets, are designed to be worn over the clinical attire to protect the skin and prevent cross-contamination from blood and other potentially infectious agents. So the gowns and jackets are expected to be cleaned and maintained as free as possible from contamination. The gown or jacket should be closed at the neck. There shouldn't be any V-necks in the office. It needs to be closed around the neck, and then it needs to be fastened in the back. In our clinic, we do have, let me grab my little pointer here. I think I have a pointer. There we go. We do have these disposable gowns. Well, that doesn't look disposable, but these gowns here, I believe this may have even been taken at Herzing, the old place, maybe not. And they close in the back. You can see this tie here, and it ties around and in the back. Notice how it comes up on the neck. There's no V-necks. This here would not be acceptable, okay? You need to wear a gown over it. The fabric should be disposable or reusable. If it is reusable, it needs to be stain and fluid. Well, both need to be stain and fluid resistant, but it needs to be able to be washed commercially and withstand washing with bleach. Okay, so there are guidelines to what material can be used. The gown must cover the knees when you're seated. So if you look here, this comes down here, these come way down. So it needs to cover your knees also, and that's because often you aren't wearing it, you're going to be wearing your pants home or such, so you want those knees covered. Now, if everything is laundered at your office, laundered commercially or sent out from your office, you wear street clothes to work, change into scrubs, and then change into your street clothes when you leave, then those are then sufficient, okay? Because that nothing that has been exposed is then going home, okay? Now we do want and always have to wear long sleeves here. You'll notice all of these have long sleeves. This here is not acceptable. And they need to be cuffed at the end. See how these have cuffs here? And that cuff is so that your gloves can go over the cuff. I'm doing the motion. You guys can't see me. But going over the cuff of the jacket. Okay? In addition, a washable or disposable apron may be used over a gown or laboratory coat when clinical procedures involving blood spatter or aerosols is performed. Now, if it's soaked or soiled by infectious material, you need to change the clothing immediately. So if you have, anything, I can't imagine in a dental office, unless it was an emergency, somebody fell and it gets soaked with blood, you need to obviously change it immediately, which is common sense. You don't want your next patient to see it anyway, right? During protective clothing removal, you're going to turn your gown inside out, and that's so that if anybody were to touch it, they're touching the inside, the clean part, okay? So it's just that, they aren't exposed to infectious material. Now, let's talk about hair covering. Hair needs to be worn off the shoulders, and it needs to be fastened back and away from the face. You don't want anything flying around. Remember, your hair is exposed to contamination throughout the day, so appropriate head cover is advised when you're using handpieces and ultrasonics. Now, we don't wear it here, but it is, you would want to wash your hair frequently, daily when you are working with ultrasonics and getting all that bacteria in there. And then facial hair needs to be covered with a face mask or a face shield. All right, let's talk about the use of face masks or respiratory protection. Basic personal barrier protection is composed of the face mask, and we're going to talk about it first because it's what we wear, what we put on first. Oh, let me move my little highlighter there. The protective eyewear is then placed after the mask. Okay, so there is a proper sequence. First we talk about the gown because you're going to go gown, mask, eyewear, wash hands, gloves. Okay? Aerosols, the dispersion of the particles of debris and polishing agent, calculus, water, all of those are contaminated by the patient's oral flora, okay? So you're going to be inundated with all this aerosol. So we have to wear a mask so we don't breathe it in. Remember, those small particles can go down into the lungs. And then the mask and glasses is going to protect your eyes. So aerosols are created when you're using the handpiece, the prophy angle, power-driven scalers, power-driven air polishers. So, you want to make sure that you're wearing these at all times. Evidence of the spread of particles appears on the splashed face, protective eyewear, and uniform on the barriers placed on the patient for protection from spray. So the patient also wears the eyewear, okay? Mask efficacy, okay? The filtration is measured by the BFE, and you can see that here, okay? I believe this is a question on your worksheet. So it is, that's the bacterial filtration efficacy there. And the American Society for Testing and Materials uses a standard test method, and that is the BFE, on all medical face masks. The measurement, the BFE measurement, is a measurement of the mask resistance to bacteria. A use of a surgical mask will cover the nose and the mouth, and it'll cover it with greater than 95% bacterial filtration efficacy at 3 microns. Okay, so when we're looking at the aerosols, that's pretty good. The only thing we talked about that is really contaminated after, that's smaller than that, is tuberculosis. Remember, we have separate guidelines for that. All right. So I believe this asks for the steps on your test and also on your worksheet. So it needs to be positioned, the mask needs to be positioned before gloves and goggles, okay? So you're going to go, I would add gown here, gown, mask, goggles, hand wash, gloves. I believe on your test it takes the hand wash off. I believe it's assumed there, okay? So gown, mask, goggles, gloves. Every patient that you see, you need to put on a new mask, okay? So you want to change the mask between patients every hour and when it becomes wet. Those are the 3 times you need to change a mask. Now, in class, I had stated that the yellow sheet I gave you, it says when it becomes wet, I think in every patient. But here you need to know that it's all 3. Every patient, every hour, and when it becomes wet. Okay? This is also the first thing you're going to remove when treatment is completed. All right? And particles smaller than 5 microns may remain suspended up to 24 hours. So even though your mask is off, there is still stuff in the air, floating around in the air. All right, let's talk about our eye protection now for a minute. Let me get a sip of water here. Eye protection for the dental team member and patients is necessary to prevent physical injuries and infections in the eye. So there are severe and debilitating eye accidents and infections that have been reported in the dental setting. Eye involvement may lead to pain, discomfort, loss of work time, and in certain instances, permanent injury. Accidents can occur at any time, and as with most accidents, they can occur when you're least expected and least prepared. Eye infections can follow the accidental dropping of instruments on the face or splashing of the materials from a patient's oral cavity into your eye or their eye. Contamination can be introduced from saliva, biofilm, carious materials, multiple restorative materials, bacteria-laden calculus. Things are flying around when you're cleaning in there. And they can all be in aerosols and spatter. So wearing eyewear is going to really eliminate a lot of that amount that's going through the entry, or the port of entry, which is the eyes, okay, in this case. So careful deliberation and technique and instrument management, along with using proper evacuation, is really important in preventing eye accidents also. All measures described for the prevention of airborne disease transmission by aerosols and spatter apply to eye protection. The most effective defense is the use of protective eyewear by all involved, so you and your patient. All right, now indications. Protective eyewear is worn for all procedures. Okay, dental personnel who don't require corrective lenses for vision must wear protective eyewear with clear lenses. Now that is going to be a little bit different for our patients. They might want it tinted, but you don't want it tinted too much. Like some people like to wear sunglasses, and that's fine. But just know you can't see your patient's response and if they're in pain if they're wearing that. Okay, so sufficient eye coverage with side shields to protect around the eye. Shatterproof, they should be shatterproof, strong and durable, but also you want them to be lightweight and flexible. Another key element is that you want them to be easily disinfected. So you want nice smooth surfaces that you can clean, and you want to, most of them are going to leave like a residue on them after being disinfected. Also, having those disinfectants so close to the eye, we kind of all in dentistry go back and forth on what the best way is to clean your eyewear, but disinfectant used cannot damage or distort the frames and lenses, so you got to be careful what disinfectant you're using and have something that's durable enough for it. So a clear or lightly tinted, again, for the patient, but you may not be able to see their eyes, and for sure when using nitrous they shouldn't be wearing any eyewear, because you need to be sure that they aren't being sedated further than what they should be. All right, so desirable but not required, you want scratch resistant, anti-fog, anti-static. So types of eyewear, we have goggles, and they shield on all sides of the glasses and are probably the best protection provided. They fit closely around the edges, and the goggle style coverage is especially necessary for protection against laboratory work. Eyewear with side shields, especially if you have prescription glasses, this is what you'll be doing, putting on little side shields on your prescriptive glasses. And they can be provided and add protection for the member of the dental team who depends on prescription lenses. Okay. Eyewear with curved frames, when the sides of the eyewear are curved back, they do provide a protection somewhat similar to that offered by those with side shields. Another one I want to touch on is the dental loops, and they are designed to protect the eyes and magnify the oral cavity. And we're going to talk about those in preclinic. A lot of students do choose to buy those. We do have, there are child-sized sunglasses and children's play glasses that they might want to use. And then we can also use a face shield, and a clinician needs to wear a face shield over a regular mask when aerosol producing handpieces, power scalers, or power polishing is used. Protective eyewear for patients. Again, just make sure that their eyes are protected during the appointment, okay? You also want to make sure that they don't have any glare, because you want to be able to see their pupils and see their eyes. All right. Suggestions for clinical application: contact lenses. The dental team members and patients who wear contact lenses always need to wear protective eyewear over them during the dental and dental hygiene procedures. When you're caring for your eyewear, you want to run them under water to remove any abrasive particles. You want to avoid rubbing it. You want to rinse them off really good first, because you don't want to scratch them by rubbing that polishing agent into them and scratching them, okay? They may also be damaged by disinfectants, so you want to make sure that you use a clean detergent and rinse and dry them thoroughly, especially with loops. Check periodically for scratches on the lenses and replace them appropriately. Now, eye wash stations do need to be attached to a sink that's not used by clinicians for patient preparation. It must not be connected to the regular faucets unless the hot water source is turned off. And that's really important, because you can burn your eyes. In a situation, you don't want to feel the temperature, right? You just want to get that rinsed out of your eyes. All right, this next slide shows it's Katie's eye, and I don't know the whole background here, but I believe she was a student here and was out in practice, and she got something in her eye, and she did lose partial vision here, but you can see all of this swelling around here from getting a massive eye infection by not wearing glasses. All right, let's talk about the oh so important hand washing. In infectious process of disease transmission, hands serve as a mean of transmission of blood, saliva, and dental biofilm. The hands, especially under the fingernails, may serve as a reservoir for microorganisms. You guys are going to end up being so grossed out by long nails, you're never going to want them again. But the skin breaks in the hand also serve as a port of entry. So really maintaining proper hand hygiene and hand washing procedures is going to help minimize the transmission of diseases. All right, so the bacteriology of skin, resident bacteria, many relative stable bacteria inhibit the surface of the epithelium or deeper areas in the ducts of the skin glands or depths of the hair follicles. Ultimately, they are shed with the exfoliated surface cells or with excretions of the skin glands. Resident bacteria tend to be less susceptible to destruction by disinfection procedures. Now, we have transient bacteria, and the transient bacteria reflect continuous contamination by routine contacts. Some bacteria or pathogens may act temporarily as residents. Now, transient bacteria may be washed away, or in the event that a skin break occurs, it can cause an infection. Okay, so most of them can be removed with just soap and water by thoroughly washing, or with hand sanitizer, the 60 to 95% ethanol or isopropyl based hand rubs. And then you have to follow the manufacturer's directions, right? All right, so fingernails. They make hand washing, having short nails is going to help make hand washing a little easier and more effective with fewer microorganisms harbored under the nails. You want to prevent cuts from long nails in disposable. With long nails, you can cause cutting of the gloves. Also with rings you can. So you want to also make sure that you have the proper fitting glove. Okay. Artificial nails also act as a reservoir for bacteria, and they can get under the acrylic. The CDC really frowns upon gel nails, which you think, oh, they don't chip, so they wouldn't have the bacteria reservoir that acrylic have. But the gel, because of the breaking down of the nail due to gel nails, they say absolutely no gel nails. Okay, so no nail polish because of the chipping, no acrylic nails or nail extenders. All of those harbor bacteria. Also under rings, you aren't supposed to wear rings. Now we do allow a small band in clinic, but under that ring you can harbor a lot of bacteria. So you want to avoid wearing that in clinic as much as possible. Same with wristwatch and jewelries. Again, they're just going to harbor more bacteria. If you are wearing a watch, it needs to be covered by your gown at all times. So really, what's the point? You can't see it anyway, right? Gloves. After hand washing, you're going to put on gloves. Never expose open skin lesions or abrasions to a patient's oral tissues and fluids. So always make sure you're wearing gloves. After glove removal, wash hands. So when do we wash our hands? Before we glove and after we remove our gloves. Always. All right. So hand hygiene. Our rationale is that effective and frequent hand hygiene can keep the hands nice and clean and prevent transmission of bacteria. It's impossible to sterilize the skin, but we want to make every attempt possible to reduce the amount of bacterial flora on our hands. Okay? So purpose, the hand hygiene, including hand washing, hand asepsis, or surgical hand asepsis, is critical for reducing the bacterial flora on hands. The chosen method is dependent on the procedure and the degree of contamination. So an example of effective hand hygiene procedure can be expected to accomplish the following: remove surface dirt and transient bacteria, dissolve normal greasy film off of the skin, and rinse and remove all loosened debris and microorganisms. So again, if you're going to go into surgery, it's going to be a different hand wash than just coming in and talking to a patient, right? All right, so when we talk about facilities, we want to make sure that we have a sink that has a foot pedal or electronic control from the faucet, so that you don't have to turn the faucet on and off. If you do, you want to wash your hands and then grab a towel and turn it off with the towel, okay? So you have a barrier between your clean hands and that dirty faucet handle. You want to use a separate area and sink reserved for instrument washing than you do with hand washing, okay? Contaminated instruments must be removed from the treatment room before preparing for the next patient setup. Now soap, you want to use a liquid soap. Apply from the foot pedal or knee activated, electronically activated soap dispenser. So just like the sink, you want to try and have a soap dispenser that is electronically dispensed, along with towels. You want to just wave your hand and get a towel rather than touch something and get a towel. And all of this, we want to avoid using, when we're cleaning our hands, some people like to use brushes, but you want to avoid that over vigorous brushing, because that could also abrade the skin. All right, so excuse me, my throat gets very dry talking this long. You want to make sure that you're washing your hands always before you place your gloves on and after glove removal. Notice how that's on multiple slides, okay? And then you want to remember clean on clean, dirty on dirty. So clean on clean, dirty on dirty. Gloves are always considered contaminated, okay? And I want you to know that for clinic, because when we say clean on clean, dirty on dirty, we're always going to assume, even if you say, oh, these are new gloves, that doesn't matter. They're always considered dirty, okay? So when you're touching something, if you're touching something that needs to be clean and your glove is dirty, then that would be a violation of protocol. All right. When you're washing your hands, of course, you want to wet them first. Apply the soap. You want to make sure that you get under the nails. A surgical antisepsis is performed at the beginning of the day, and that can be a 10-minute wash. Okay, and then subsequent ones would be 3 to 5 minutes. Now we do a modified surgical wash here, and we're going to learn more about that in clinic. But you want to make sure that you remove all your jewelry, that your hair is covered and everything before you wash your hands, because you don't want to touch any of that afterwards, right? Then you're going to put on your protective eyewear, or you're going to put it on after your initial wash, but you're still going to wash before you put your gloves on again. Okay, so you've washed your hands. Now we're going to put on our gown, we're going to put on our mask, put on our glasses, wash our hands, and put on our gloves, okay? All right. Now, the hand sanitizer, one thing I want to touch on with that is that you want to put it in the palm of your hand, and you need to rub your hands together for at least 30 seconds with it. If it dries before that, It maybe isn't the appropriate hand sanitizer or not the appropriate amount. All right. So again, before and after treating each patient and before and after glove removal, we're going to wash our hands. Before regloving, after removing a glove that's torn or cut or punctured, you want to wash your hands. After barehanded touching inanimate objects, you want to wash your hands, especially if they're contaminated with blood or saliva. When hands are visibly soiled, you want to wash your hands. Before leaving the treatment room, you need to wash your hands. So notice you are constantly washing your hands. So of course, good hand hygiene and keeping your skin intact, especially in the winter when it's dry, is really important. Okay, so a routine hand wash is at least 15 to 20 seconds. Antiseptic hand wash, 3 short lathering and 3 rinses to 30 seconds. Antiseptic hand rub until it is dry. We use the Vianexus in our clinic. And again, you're going to rub it until it's completely dry. And that doesn't mean, waving your hands in the air to get it to dry like a lot of people do. Remember, there's all that dust bacteria in the air also. So you want to rub until it's dry. Surgical antisepsis, surgical scrub, again, the first is 10 minutes. Subsequent ones are 3 to 5 minutes. Modified Herzing, 2 short 30-second latherings and 2 rinses using an orange stick. It's a cuticle stick on the first lathering. All right, so first wet hands, add soap. You're going to scrub the backs of the hands, wrists, between the fingers, under the fingernails, and that's where we're going to use our cuticle stick. And then you're going to rinse. And then we're going to actually start over with the soap again here at Herzing. Wash for 30 seconds. Apply the soap. Scrub for 30 seconds, rinse, and then we're going to towel dry. And you can see in this picture here that they're shutting off the faucet with a towel. We do have foot pedals in our clinic, so we don't have to worry about that. But if you work in a clinic that doesn't have that, then you would be turning it off with the towel. Okay? All right. As Esther Wilkins says, hand washing is considered the most important single procedure for prevention and cross-contamination. Okay, wearing gloves is a standard practice to protect both the patient and the clinician from cross-contamination. Criteria for selection of treatment of examination gloves, we have to consider safety factors, infection control. It is an effective barrier. We want to make sure that there's good quality control standards by the manufacturer. Impermeable to the patient's blood and saliva. We want them to be strong and durable to resist tears and punctures. And we want them to be impervious to materials routinely used during the clinical procedures. And we want them to be non-irritating to the skin. So use of non-latex gloves when the patient or clinician is allergic is really important. And then the length, you want the cuff to be long enough that it can extend over the cuff of the long-sleeved gown. Okay, so this glove cuff is going over the cuff of your gown. All right, ergonomic factors. Yes, there are ergonomic factors when it comes to gloves. We want to make sure that it fits well and doesn't interfere with the motions that you'll be moving in. We want to make sure also that it doesn't interfere with our tactile sensitivity, and that's the tactile sensitivity is being able to feel the vibrations in your instruments, knowing where there is calculus and where there isn't. Because remember, we're working under the gums, so you can't see everything, so you have to feel it. Okay, so you don't want that tactile sensitivity decreased. You also don't want it to pull tight over the palms or between the thumb and index finger. Okay? Now, Materials used, there is latex and non-latex. Non-latex includes neoprene, black copolymer, vinyl, nitrile, and those can all be used for patient care, and they are non-sterile single-use examination gloves. Now there is sterilized single-use surgical gloves, but those are saved for surgical procedures such as reflecting the gingival tissues back, doing a flap surgery or something like that. All right. Then we have utility gloves, and our utility gloves that we use here are going to be nitrile gloves, and they need to be puncture resistant for clinic cleanup. So you're going to be cleaning up. These are used, and you need to know this, these are used for cleanup, and so you're wiping down your unit ahead of time, you're wiping down the unit after. These are also used to bring the instruments into the sterilization room and put them in the ultrasonic, or we have a hydrum, which is a washer for them. So handling of dirty instruments during transportation and bringing them to the sterilization area is another time where we're going to be using our utility gloves. And then there are some offices will use food handlers gloves, and that's just to slip over your patient treatment gloves and maybe write something down or whatever. We don't use those here. We wipe everything down, and really there's no regulations on those, so a lot of people have gotten away from that. Procedures for use of glove, again, we're going gown, mask, eyewear, gloves, right? So we're putting these on last and after we've washed our hands. You also want to prevent the need for manipulating the mask and glasses once you have your gloves on, okay? Because you don't want to risk touching your hair or anything, so you want to avoid all of that. Pre-gloving hand care, again, we went over using the antiseptic wash or washing your hands thoroughly. Glove placement, always glove and deglove in front of the patient so they know that you're using a new fresh pair of gloves. Place gloves over the cuff of your long sleeve clinical gown. Avoid contamination. Keep the gloved hands away from your face, hair, and clothing, such as pockets. You don't want to touch the telephone. You don't want to touch the records, anything that doesn't have a barrier on it. Always inspect them for any tears or cuts, and if there is any, and if you get one during the procedure, you're going to remove it immediately, wash your hands, and put on new gloves. Excuse me. Let's see here. Develop a procedure where the gloves can be removed without contaminating your hands. So you don't just grab it and take it off with your hands, right? So you have to think of how are we going to do this. And I'm trying to think if we have a slide. We don't have a slide on that, but we'll demonstrate that in clinic. It's where you grab the outside of one glove and kind of pull it over, kind of loosening it over your other glove and turning it inside out. Then you're going to do that with the other hand. And once you remove one glove, then you can grab the inside of the other glove with your clean hand and take it off. So a little tricky, I guess. I'll either do a video or a demonstration, or in pre-clinic you'll see it. Okay, your book might have some pictures on that. Let's see here, where was I in my notes? Okay, length of time worn. A new pair of gloves for each patient is the basic requirement. Total time worn shouldn't be longer than an hour. When gloves start to develop a sticky surface, then we want to remove them, wash our hands, and re-glove with a fresh pair. It's also going to depend on the complexity of the procedure. what is more likely to promote perforations in the gloves? Using sharp instruments, of course, right? Let's see here. Glove size, when it's too long, the extra material at the fingertips can get caught and torn. And then when it's too small, objects are difficult to handle, especially sharp instruments. So you just don't want to, you want a good fit. Pressure of time, stress, working too fast increases the risk of glove damage. Storage of the gloves, you want to keep them in a cool, dark place. If they're exposed to sun and heat or fluorescent light, it increases the potential of deterioration. And then agents used, certain chemicals react with the glove material. For example, petroleum jelly, alcohol, and products made with alcohol tend to break down the glove integrity. So you really want more water-based hand care. Okay, aquifer is a good one. All right. Hazards from hands, long fingernails, and rings worn inside the gloves can puncture the gloves. Okay, here it says, must wash hands prior to putting on gloves and after removal of gloves. All right. Material, latex and non-latex. Latex, we're concerned with allergies. So for our patients, we're going to either use the non-sterile single, I should say single-use gloves for examination and treatment. But if we're in a surgery doing scaling and, when the tissue is flapped back, then we're going to use sterilized single-use gloves. And then our utility gloves, again, are to clean up our rooms and to transport sharp objects such as our instruments from the treatment area to the sterilization area. All right, here's a couple examples of gloves. B is obviously a little too long in the fingertips here, but it is nice and loose here, right? Here, looks pretty tight here and in this area, so this would be too small, this would be too big. It's like Goldilocks and the Three Bears, huh? Right. Next is showing the use of utility gloves. They are being used to put the instrument cassette in the ultrasonic bath here. All right, order of our PPE, gown, mask, then eyewear, wash hands, put on gloves over the cuff of your lab jacket. If they're torn or punctured, take them off, wash your hands, and put on new gloves. Remove gloves after the procedure. Hand wash always after removal. Then place a new pair on for the next patient. I think we've beat that down enough. Okay, here's the picture of how to take off gloves properly. All right, so factors affecting glove integrity. Of course, the time worn, a new pair for each patient is the rule. Certain procedures that are more likely to promote perforations. Size, the glove fit must be precise, otherwise you're going to lose that tactile sensitivity, and if it's too long, the fingertips can get caught or torn. It's also really hard to take x-rays if they're too long. Storage, keep glove box in a cool, dark area. Avoid fluorescent lights and heat and sun exposure. Agents, certain chemicals react to glove material, such as petroleum jelly, Vaseline, or chapstick from your patient's lips can break them down. Also, alcohol and products made with alcohol tend to break down the glove integrity. And that's why we need that alcohol-based hand sanitizer, why it needs to be completely dry before we don our gloves. Hazard, of course, using fingernails and rings worn inside is going to tear our gloves, right? Now, let's talk a little bit about skin conditions. Here's our non-allergic dermatitis from wearing latex gloves. And that's often due to not drying your hands properly before putting them on. Kind of a rookie mistake when you first get into practice because you're in such a hurry and you don't dry your hands, and that's what they look like. The first year I was an assistant, that's what my hands looked like. All right, now let's talk about latex sensitivity. Symptoms of hypersensitive reaction range from dermatitis to life-threatening anaphylactic shock, so it can be very serious. The only available treatment for latex allergy is avoiding contact. Latex sensitivity is due to the protein allergens and to additives used when commercial latex is prepared. Latex allergens occur in any equipment or product used that contains NRL. Gloves are most frequently used item that contains latex, but I would say all offices have gotten rid of it. The only time I've seen latex in the last probably 15 years is surgical gloves. I had a dentist that I worked for that had just a perfect fit surgical gloves, but they were latex, and so that was the only downside. But almost everything else has gone to nitrile in practice. Clinical manifestations, methods of exposure, direct exposure to latex products, and then aeroallergens. So this is inhaled allergens when the powder or the cornstarch from the gloves become airborne. So you think of that dust that's in the air that has latex on it. So people who are super sensitive can have a severe reaction. So we want to see these patients at the beginning of the day if they have a true latex allergy. Again, also, if they're not using latex gloves in your office, you don't have to worry about that cornstarch being in the air, right? And then mucosal contact. So the type 1 hypersensitivity, they're going to get hives, dermatitis, might have sneezing or itchy nose, runny nose, watery eyes, drop of blood pressure or shock, and then anaphylaxis. So we want to be really careful with that. Then they can also have a type 4 hypersensitivity or a delayed reaction, and that's where dermatitis develops 8 hours to 5 days after the contact. Some people will get like a contact dermatitis all around their mouth. All right, individuals at high risk for latex sensitivity, you do need to know this. I believe it's on your worksheet. And it is occupational exposure, so those healthcare providers who wear latex all the time. People who have multiple medical procedures or treatments that require a lot of latex tubes or drains, such as genitourinary anomalies or spina bifida, can also be at a higher risk of a latex sensitivity. And then people who have documented allergies to certain foods, such as avocados, bananas, kiwi, chestnuts, papaya, peanuts, they can also have allergies. So again, healthcare providers, people who have spina bifida or genitourinary anomalies where they need a lot of tubes placed in their body, and then people with food allergies such as avocados and bananas, kiwi, chestnuts, papaya, and peanuts. Medical history, when we're talking about management, just taking a really thorough medical history, including food allergies, is really important. Document all information carefully, recording for continued reference, and then treatment in a latex-free environment. We want to make sure that maybe they are there first thing in the morning so there isn't anything in the air. Okay. Let's see here. Clean clinical areas. Personal preparing the room should wear non-latex gloves. Again, we use nitrile in our clinic. Most places do now. Prepare latex-free carts. So if you guys do use latex in your room, maybe you want to create a cart that has all latex-free products. So if we do have a patient in that has a latex allergy, we're prepared. Emergency treatment equipment. Inform the entire dental team of the appointment and have a latex-free emergency cart available and alert anybody if there is an emergency. All right, and here's a nice list of products that may or may not have latex on them in the dental office. When we talk about documentation, we want to document any irregularities in personal protection, care provided for patient with latex allergy. We want to refer the patient with suspected tuberculosis, latex sensitivity in medical in the patient, and we want to have a medical alert on their chart. It's funny because, when I started, we weren't using computers as much, so we had these stickers, but now they just pop up on the front of the screen. All right. Quick review. When should the face mask be changed? Every hour, when it becomes wet for each patient, or all of the above? And it is all of the above. All right, factors to teach your patient: the need for patients to complete their medical history for protection of both the patient and the professional, the dental health care provider, I should say. Purpose for the use of barriers, face masks, protective eyewear. We're protecting us, but we're also protecting the patient, right? The importance of eye protection, why they need to wear those glasses. They don't want to get any, let them know there's bacteria that's going in the air, and you want to avoid an eye infection or an eye injury. And then significance of hand hygiene and control of disease transmission. So it's not just in the dental office. We need good hand hygiene everywhere, right? All right, thank you for listening. I will get the next video out to you soon.